Today we're going to be talking about a different approach to socket preservation, utilizing extracted teeth as an autogenous demineralized dentin matrix graft product. Things to know about dentin grinding. Bone dentin has been researched since the 1970s and has a lot of research to support its use. The benefits of dentin and tooth structure is that it is osteogenic like bone. It becomes an autogenous product, which we all know is our preference when grafting. It is known to have bone morphogenic proteins in its matrix. It's considered to be bioactive, which helps with the bone deposition, scaffolding, and encouraging bone regeneration. The enamel from the tooth has also been shown to have BMP2 bioavailability as well. I've listed here some of the literature for the dentin grinder in its support and its use. I'm not going to go heavy into the literature for the case study here today, but I do present it for you to be able to go back and look it up as needed for more information. So now, what are the advantages of using dentin products tooth structure for a grafting material? First, it's a good source of autogenous bone. The second big one is that the price, obviously, because the patient would be supplying the bone graft, is substantially cheaper than purchasing freeze-dried bone graft. It also allows you to avoid the use of allografts and xenografts, which is important with patients that may have concerns with using either bovine or cadaver bone in their cases. Again, it has good scaffolding support. It does have a good resorption profile that works well, not only for buccal bone defects, but also forming good dense bone for implant placement. What are some of the disadvantages? Well, first of all, when we're using dentin grafting and taking an extracted tooth, it's important for us to clean off that PDL. It's important for us also to have any restorations or any composites or amalgams out of that tooth. We also want to make sure there's no decay. And one of the problems then, obviously, is the disadvantage if a tooth is root canal treated. Currently, that has not been figured out how to use a root canal tooth for this process. So therefore, it sort of weighs that endodontically treated teeth would not be able to be used. And unfortunately, many of our cases where implants are involved are the failure of an endodontic treated tooth that leads us to this process. Next, you need to have available teeth. So there actually has to have been a tooth that you're removing to use. Now, one thing to note is if you have the tooth is removed, you can actually store that. And if you want for more information on that, you can actually store the person's ground tooth for a period of time, if the case was going to need a grafting in the future. And also the other thing is there is a bit of a time concern here. You're extracting a tooth. It's easier to pull some allograft out of a bottle and do the grafting, as we're going to need at least 20 minutes to do the work that's required to get the tooth to the grounding process and ready for grafting. So this case we're working on today is an adult patient where there's 4 wisdom teeth that are coming out. You will note there is a couple supernumeraries. These supernumerary teeth have not caused them any issues and are staying in place. So right now there's a patient who needs his wisdom teeth out. He's getting pocketing and partial coverage with flaps of tissue and getting lower infection and wants to have them done. As this patient is 25, we also have to understand that extracting these teeth can lead to bigger bone defects, as he's got these roots are fully grown, and so we have to take that into account where preservation of these sockets to prevent future pocketing behind the lower and upper second molars is valuable. This patient's both healthy, non-smoker, and again is a 25-year-old male. Now let's go through some of the case things to discuss. We're going to be taking out his 4 wisdom teeth. In this case, one thing that works really well with the dentin that we have found is taking PRP, PRF, which involves removal of blood from the patient centrifuging it. In this case, we're going to be using the intraspin centrifuge, and then we're going to be using a smart dentin grinder by Cometa Bio to mill out 2 upper wisdom teeth to provide us with a dentin graft. While we're processing this graft, we're going to go ahead and remove the bottom wisdom teeth, and we'll be able to use from the 2 wisdom teeth enough graft material to fill all 4 quadrants quite adequately. So in a time perspective, it works out well in a case of 4 wisdom teeth in order to be able to take out the upper 2, have an assistant going to grind them while you're working on the lower wisdom teeth. We're going to use the PRP taken from the patient to saturate the graft material, and we're going to use PRF membranes over the graft to hold it in place, and then we will suture with just regular chromic sutures. Next, we're going to look at just a couple quick slides on the PRP, PRF. As many of you have started to use, we are finding PRP, PRF helping our healing and preserving our sockets and setting our cases up for implant placements even better than before. Here we're taking the blood from the patient, and now we've placed them in our intraspin centrifuge, and we will set those up at 12 minutes at 2700 RPM. Now, while the centrifuge is going, that was the time where we were taking out the upper wisdom teeth, and now what you are seeing here is the upper wisdom teeth have been removed and they are off to get processed, and we have the PRF plugs from the centrifuge, and we are going to put them in our kit to compress these into membranes. Now you can see a couple of the membranes that have been flattened and are ready for placement over our graft. In this slide, we're showing just some extraction of PRP, which we are using a test tube with an anticoagulant, so then we can take out PRP liquid and then hydrate our bone with that product. If you're doing a single socket, or another option that you do have is to use in the intraspin system a white tube for fabrication of sticky bone, which is just fine as well. I'm going to show you briefly some of the clips of the extraction of the upper wisdom teeth and what the sockets looked like. Okay, now we're going to be looking at cleaning off the teeth and preparing them to go into the dentin grinder. So what is important, we're using a red chamfer diamond here in a high speed, and we're cleaning off all the PDL ligament from the surface of the roots. And then we did go in and clean out the grooves on the occlusal surface for any decay. Now here's a shot of the teeth that are cleaned and ready to go into the grinder. Now our next plan is using the Cometa Bio machine to do the dentin grinding. This machine is very nice because it will give us, following the grinding and sorting, it will give us 2 containers of graft material, one a denser smaller particle and one a larger particle distribution. The benefit of that is deeper in the socket, you might want to use the finer ground dentin, and in the surface, or if you had a buccal defect, you could use the larger particle, which would have a longer resorption profile. So we put the teeth, we're going to do one tooth at a time. We put the tooth in the container, we turn it on the lock, and we now set the dentin grinder for grinding, and we're going to do 3-second cycle, and it's as many, you just keep repeating the 3-second cycle until you get to the grind position that you feel like you've ground that enough. Next, you can enter into the sort. So you're going to sort for a 20-second sort, and this is where it's going to vibrate, and the dentin particles are going to move down through the screen and into the two different compartments of the grafting. If after the sort you still have some particles that are on the surface or larger pieces that are left, you may go back to grinding those and then again resorting. So after the grinding and sorting, the top compartment will contain the larger particle dentin, as seen here, and the lower compartment will have the more finely ground graft material. Our next step here is to clean the dentin graft and to demineralize it. To do this, we are going to use a solution of sodium hydroxide and ethanol. The process to do this is basically you place the dentin graft into the glass containers that come with each kit. You then saturate the graft with the liquid using as many drops as required to fully cover the graft with the liquid. Close the lid on the container and let the container sit for 10 minutes. Following this, you're going to blot it dry with gauze, and then you're on to the next part, which is buffering the solution. In this case, we're going to do 2 rounds of buffering of about 2.5 minutes each. Again, you're going to be soaking the graft, having the liquid completely covering the graft, and then time it as a 2.5 minute, and then dab it dry, soak it again, 2.5 minutes, and dab it dry again. Now that we've got our teeth extracted and our graft prepared, we're taking out a portion of the graft and soaking it with some of the PRP that we did from our blood draw. Now we'll move on to a couple clips of extracting of the lower teeth, and then we'll be prepared for the graft. So now that we have our bone graft material ready, all the wisdom teeth extracted, and our PRP, PRF ready to roll, we're now on to filling the sockets in and suturing. The key with this, just like regular autogenous grafting, or even allografting for that matter, is to lightly pack the graft material into place, fill the sockets up. You're then going to cover it with the PRF membrane, hydrate the membrane and or the bone graft with the PRP, and then suture closed. Suture choices can be a variety based on your preference. We'll often use 3/0 chromic in most cases, and sometimes we'll use a little bit of periacryl to make the stitches last a little bit longer. Another option, of course, is PGA sutures that last longer, Vicryl that can last a little bit longer as well, especially in single cases or flaps that have a bit of tension. You're going to need to maybe use 2 different types of sutures to give you sort of the best of both worlds. So now let's just watch the grafting being placed in the sockets and the suturing. So now that we have our patient is all finished up, we have our suturing done and the grafting finished. Patient is ready to go home, and we're going to send them with standard post-op protocols that you would give for any surgical case. And in this case, we gave him a prescription for amoxicillin for a week, dexamethasone for swelling, and ibuprofen and Tylenol 3s for pain control. We brought the patient back at 2 weeks for some post-op pictures of the healing. One thing to note, we have found that he only had to take very little painkillers, and he had very little swelling and very little discomfort. As many of you have probably noticed that for example, when you do an immediate extraction and implant placement, a lot of times people have less discomfort. Definitely when you're doing socket preservation, patients tend to have less postoperative discomfort. If you make a big hole but you fill it, people tend to feel much better after, and this was the same case in this case and other cases that we've done. We have found that the post-op, especially with wisdom teeth extraction cases, people are a lot more comfortable. Now we have some shots of the different socket sites closing up well, no sign of any infection or inflammation. At 6 weeks post-op, we did take an x-ray. This is the pan shot, and we've got now some close-ups. And again, here's some pictures of the tissues inside, everything looking very good, patient feeling comfortable. So now let's take a look at some before and afters. And this one we're showing on the top one is the pan with the wisdom teeth in place, and the lower one is at 6 weeks with the wisdom teeth removed. Here's a close-up of the 1/8. On the left you can see the wisdom tooth in place, and on the right you can see the socket. Here we go down to the 4/8. On the right, on the left you can see the tooth in place, and on the right you can see the graft pretty well in this image and how those sockets have been filled in. This is a shot of 2/8, and here is 3/8. Thank you very much, and I hope this will help you with consideration with your wisdom teeth cases to help your patients.